Hi everyone. We'll start in around 5 minutes. Thank you for coming. If you want to come up to the stage to ask questions, please go ahead. Um, hey,
Hello.
how are you? How's your day?
Well, a little mixed.
Well, yeah,
Let's conclude a mixed day with low doses of LSD states. Huh?
yeah. Let's see how that would look like. Hi Z, hi Wisdom. If you also want to join up here, please feel free. Hi Ahmad. Thank you for coming. If you want to join the conversation, please join us up on the stage. Hi, Hannah. How are you today? Thank you for coming. Can you hear us?
Hi. Yeah, sorry. I'm still trying to get used to the app, but yes, I can hear you.
Perfect. We'll wait a few minutes, like 3 to 4 minutes, to give people time to arrive, and then I'll introduce you, and then the stage is yours.
Okay, sounds good.
Yeah, we can slowly start by introducing you and so on, and then we can always like let me just sorry pin the article to the room, and then we can start there. Great. There's the article, so people can follow along and read. And yeah, so welcome to the Science Society. We are very honored to have Dr. Hannah Molla presenting her. She's the first author of this study. And yeah, let me tell you a little bit about her. Dr. Molla, she did her Bachelor of Science and Arts in Biology and Psychology at the University of Colorado in Denver. And then she did her PhD at the in pharmacology under the mentorship of Dr. Kuei Tseng, where she studied the role of the endocannabinoid system of the prefrontal cortical function and the impact of adolescents' cannabinoid exposure on prefrontal cortex development. And she's currently in her second year of her postdoctoral training, and she is in the Dr. Harriet DeWitt Lab, and she's interested in studying the neural and cognitive effects of drug use in humans with a particular interest in cannabinoids. But yeah, this study is about microdosing of LSD, which is really interesting. I read this book years ago. I think the name was A Really Good or A Really Great Day. So yeah, I read the study and I thought it was really quite an important study. So I'm very honored that you made the time to join us here and to tell us about your work. Thank you.
Great, Katerina. Thank you so much for the introduction. Um, yeah, so I'm happy to be here with you guys tonight to talk about the study that was just published last month from our lab. So as Katerina mentioned, I am a postdoc at the University of Chicago, and I'm working in Harriet DeWitt's lab, and she is sort of the lead researcher for this study. Um, but so this study started a couple years ago, and we just finished it up at the middle of last year. Um, and for this particular study, so I'll go over a little bit of background, and then I'll just dive right into the results and everything, and we can chat about it afterwards. Um, so in this study, we were interested in looking at how taking microdoses of LSD repeatedly could potentially impact mood, cognition, and some physiological measures as well. Over the past couple of years, people have reported boosts in mood and being able to be more productive at work from taking, very low doses of LSD every couple of days. But this hadn't really been studied before in a control setting. And so that's what we were interested in looking at. And it was really important for us to test this in a double blind manner to reduce like any sort of expectancy effects or anything. Um, so in the study, we recruited volunteers to come to the lab for a total of 5 sessions. And each subject was randomly assigned to receive either placebo, 13 micrograms of LSD, or 26 micrograms of LSD. So basically, a low microdose and a high microdose. We chose these doses because I guess typically a full dose of LSD is usually roughly around 100 to 200 micrograms, and microdosing is thought of as being a tenth of a full dose. Um, there was also a study that was published in the lab a couple of years ago, where they tested, and I say they because I hadn't joined the lab at the time, but um, where they tested different doses of LSD, different microdoses of LSD. So 6 micrograms, 13, and 26. And 13 micrograms was sort of sub threshold, so people didn't really feel much of an effect. And then 26 micrograms, they felt a subtle effect. So we wanted to include those two doses for this particular study as well. Um, so so the subjects here, they received either placebo, 13 micrograms, or 26 micrograms. And the first 4 sessions were drug sessions where they received whichever drug they were randomly assigned to. So if they were assigned to the 26 microgram group, they received that for the 4 sessions. And then the last session was a drug-free session. And each of those sessions was separated by 3 to 4 days. Um, so subjects were tested on a whole battery of tests on both the first and the last drug sessions to examine any sort of acute effects of the drug and to see whether there were any differences between the first exposure and subsequent exposure. And then they were tested again on the drug-free session to look at any sort of lasting effects. Um, so in terms of results, subjects completed many different tasks and measures to assess whether LSD had any effects on those measures. In terms of physiological measures, we didn't really find any significant changes in terms of heart rate and blood pressure overall throughout the study during the drug administration sessions. So there's very minimal effects in that aspect. Um, and when the volunteers were asked whether they felt any sort of a drug effect during the drug administration sessions, only the subjects that had received the high microdose of the 26 microdose felt an effect throughout the sessions. And this effect usually peaked at around 2 to 3 hours after administration. And again, similar to that previous study, the low microdose, so the 13 microgram group looked very similar to placebos in that they didn't really feel an effect. So again, we saw that the 13 microgram dose is basically sub-threshold. Um, to to look at any changes like in mood state, so that was another aspect that we were interested in looking at. We used several different measures, like the profile of mood states questionnaire to look at any changes in momentary mood, as well as the positive and negative affect scale. And we didn't really find much of a difference on in any like mood state, except for like increased feelings of vigor, which is kind of indicative of a stimulant-like effect. And overall, most of the subjective effects that the volunteers experienced were more stimulant-like effects, as was seen in the a couple of the different measures, like the ARCI, which is the Addiction Research Center Inventory Measure, um, that measures typical drug effects, and people scored significantly higher on the amphetamine scale on the 26 microgram group, as well as they showed increases in the on the LSD scale as well, which just measures certain hallucinogen-like effects. We also wanted to look at whether microdosing LSD had any sort of an effect in emotional processing. So we administered a couple of different tasks, and on a task that mimicked social exclusion, we did find that the highest microdose reduced negative mood, specifically during the rejection phase, but not during the acceptance phase. But on most other measures, like a task where subjects had to correctly identify facial expressions from images of faces that appeared on the screen very quickly, um, the subjects that received 26 micrograms, they did show a decrease in the rate of false alarms for fearful faces, but overall, we didn't really see much of an effect on the other expressions, and so subjects didn't really show um, on other measures. They also didn't really show much of a difference in terms of how they responded to positive and negative images. So overall, we didn't really see much of a change with repeated doses of low doses of LSD on emotional processing. Um, and in terms of cognitive changes, we administered tasks like the NBAC task to look at any changes in working memory, as well as the this digit substitution task, just to look at overall changes in cognitive functioning. And we didn't really see any differences with those tasks as well. And this was both, during acute, so during the drug session, so acute effects. Um, and we also didn't really see lasting effects during the drug free session either. Um, we also looked at what effect repeated administration of LSD had on changes in consciousness. So we administered the 5D-ASC, which basically just assesses altered states of consciousness across 5 domains. And it has been shown to be sensitive to LSD administration. Um, and we found that the highest microdose did seem to increase experiences of unity, blissful state, and insightfulness scales in a manner to where it seemed to be most prominent on that first session where they received the drug for the first time, and then it decreased on subsequent sessions, indicating, potential tolerance. Um, and at the end of each session, we did ask subjects to tell us what they thought they received at during each of the sessions, since the sessions were double blind. And so they had to select from different classes of drugs, like cannabinoids, hallucinogens, stimulants. And what we found was that less than 50% of the 26 microgram group, so the high dose of LSD, less than 50% of them were able to correctly identify that they had been given a psychedelic. Um, so, um, and so, they weren't really able to recognize uh, what exactly it was that they had taken. And the numbers were even lower for the lower microdose group. Um, so overall, we found that repeated low doses of LSD really produced minimal effects in terms of the measures that we looked at, and we saw primarily that it increases more stimulant-like effects. Um, and this was observed at only the highest microdose, but not in the 13 microgram dose group. Um, and additionally, most of the effects seem to be most prominent on the first session, and sort of declined from there. Um, and when we administered a lot of these measures on the drug-free session to look at any lasting effects, we didn't really find much of an effect, indicating that most of these effects that we saw were not enduring. Um, and so, even though we didn't see much of an effect, which was, kind of disappointing at the end of the study, um, uh, since we didn't really see much of an effect on a lot of the measures, we're still kind of hesitant to say that microdosing isn't beneficial, um, mainly because there are a lot of, different factors that could come into play. Um, to explain why we potentially didn't see much of an effect. So, for one, the study was conducted in healthy volunteers. And so, it's possible that any sort of benefit in mood that might manifest might be seen more in individuals who are depressed or have anxiety to begin with. The other thing is that we only administered the microdoses across 4 sessions. I mean, it could just be that more sessions or more exposure to more doses may be needed in order to see an effect. The other thing was we separated the sessions by 3 to 4 days, and this was really, I mean, we were kind of going into it. It was sort of uncharted in terms of, people hadn't really looked at this in a controlled setting, and so we didn't really know how often, or how long to separate the days. And so we sort of just based it on anecdotal reports, and separated each of the administrations by 3 to 4 days, but it could just be that that's not the most optimal length of time. Um, and so those are some, in terms of future directions. I think there are a lot of, different ways that we can continue the study, to see whether, whether microdosing really is beneficial, in some sort of aspect. And so there are a lot of directions that we can take this study in. So that's sort of what I have for an introduction, and I'm happy to sort of answer any questions that you guys might have at this time.
Yeah, thank you so much. I really appreciate your study. From I had like my own conflict with at the institute I was working, a company. Like, I just give you the background why I really wanted to invite you again. Um, where a company came and wanted to basically develop like different compounds for microdosing, for to give like people that have mental health disorders. And back then, based on the studies I read, it didn't make any sense to me, since it seemed like when people really had the beneficial effect of hallucinogens, it was when they had, quite a high dose and had a really profound experience. When they looked at brain imaging and also from animal study data, you saw this really change in synaptic plasticity and things that, could explain the quick onset of like uh, amelioration, would be from a quite high dose. And also throughout the I don't know, from the institute I worked in was, and he back in time to all these different um little villages where he looked for like traditional medicines, where people took like all these different hallucinogens and try to bring them back here to the US. And I strongly believe that if it would have been any benefit, people that had access traditionally to those compounds would have used it in a microdosing way. But there's no single hundreds of year old wisdom communities that use this kind of drugs in a microdosing way. We just want to basically um, push them into our 9 to 5 day job schedule, which in my mind doesn't make sense based on the data. But that's why I like your study so much. But that's already a biased view. So I appreciate you saying in the end the limitation it has. But I want to open up questions for the audience. And if you want to comment back, Anna, please feel free.
Well, I was curious about the study. You did mention it was disappointing. As I was listening, is it to establish safety margins? I'm thinking of I was stricken by the essentially the rise of boutiques and ketamine boutiques, and I'm wondering if part of the impetus was to establish that microdose, that low baseline, to where it's becomes very clear that by and large the therapy is benign, but you're just starting to titrate up to a reliable effect. So I'm wondering, I mean, will the study be repeated with 36 and 46 microgram? Or, I mean, can you comment on the future directions in that sense?
Yeah, so I think it's an interesting point. So I think that in terms of the doses that we selected right now, there for this particular study, there was such a wide range of variability in terms of individual responses. Um, on some of the scales that we measured, there were some subjects on the high microdose of the 26 microgram dose that felt absolutely nothing, and then there were subjects that felt a very strong effect. So there was a lot of variability at the dose to where people typically felt somewhat of an effect, and at the high microdose. And so we're thinking that because of this variability, that some of it just may have to do with a lot of the pharmacokinetics of the drug. So LSD is metabolized by CYP2D6 enzymes in the liver, and there's a lot of polymorphisms across individuals with that particular enzyme. And so it could just be that, however much is ending up in the bloodstream at this particular dose is just so variable across people that might be why you see more variable effects, and that, a higher dose may be needed in order to see more consistent types of effects. Because as Katerina mentioned, there high doses of LSD have been shown to be beneficial in a lot of aspects. And so, it could just be that a higher dose is truly needed, or in order to get more of these consistent findings.
Yeah, also your study shows that the when there was an impact, it seemed to be with the first dose. I also always theorized that giving repeated dose of such a drug uh, would maybe even result at some point in the opposite effect, since the brain tends to compensate, especially for high activating drugs like these that have such an high impact, could have such an high impact on plasticity. So, do you think that like chronic exposure, or basically, a chronic type of low dose treatment has any future? Because to me, it looks more like if you take it once in a while at a high dose, it shows beneficial effects, also like in gene expression and plasticity. But based on your data, it supports that probably a chronic exposure is maybe even, it could maybe even lead to the not the opposite. You don't show the opposite, but doesn't have any beneficial effect.
Yeah. So if even take a look at, I don't know if people have the paper open, but if you take a look at like figure 4, you can kind of see that the strongest effect happens on the first session, and then the effects sort of decline across subsequent sessions. And so, how we interpret that is that there seems to be a bit of tolerance that develops, at least, for tolerance could develop for certain measures versus others. And so, in the case of these altered states of consciousness, we saw a little bit of that. And even when we asked people how much of a drug effect they felt, so just overall subjective effects, that also seemed to be highest on the first session, and then sort of decreased thereafter. And so to us, that's more indicative of tolerance. So I do, I mean, I would hypothesize that the most beneficial effects that we could see, as you mentioned, Katerina, would be more so of taking it spaced out, and likely at higher doses.
Was there what controls were taken for the patients in the study previous exposure to LSD?
Right. So, in terms of our inclusion criteria, so participants had to have had at least one experience with a psychedelic before, primarily because we didn't want their first experience of a psychedelic to be with us, just in case, they might have had some sort of negative effect while on a psychedelic. And so we wouldn't want to for them to experience that again, and so that was our main inclusion criteria in terms of um, uh, past drug use history. Most of the subjects had taken cannabinoids of some sort before, and most of them drank alcohol were regular alcohol drinkers. Um, and yeah, in terms of with hallucinogens, it was just that they had to have had at least one experience with it. And they had to, of course, be drug free um, for all of the sessions, and couldn't have any drugs in their system during the study. And so those were the measures that we took.
Curious if there was any correlation between past, past exposure to LSD and the ones who showed an effect of, first experience, but rapid adaptation or tolerance.
Yeah, we didn't take a look at that, but that's an interesting thought. We did look to see whether body weight had any sort of correlation or association with it, and we didn't find any differences with that. For future studies, we were thinking about potentially collecting plasma to look at, how much LSD gets in the system, um, or how much LSD, how much plasma levels of LSD could potentially be correlated to subjective responses as well. I think that would be interesting to see.
Yeah, Dennis, Cecilia, Brenda, Mona, please go ahead and ask your questions.
All right, I can go first. Hi, Hannah. This is Dennis. Thanks for joining us. Really interesting talk. Yesterday, we had Dr. Amelia with us, and she had mentioned we were talking about serotonin 2A binding site. It was a different substance, but she had brought up that LSD also binds to the site. Now, when you were saying that, if I heard you right, you said the CTP2D6 enzyme in the liver. Is that right for the mechanism,
Yeah,
the metabolism?
yeah, CYP2D6. Yep.
So, is there any sort of test for that? Like, was that part of the? Did you look at if people had, like, what the levels were, or what am I trying to say?
Yeah, no, that's a good question. No, so we didn't look at people's what sort of variant or any whether people had any were either like poor metabolizers, ultra metabolizers, or um, just regular metabolizers for CYP2D6, which is the enzyme that breaks down LSD. And it would be interesting to see whether people that fit within those different aspects, whether they also whether that correlates with their subjective um, responses or subjective effects of the drug. And my guess would be that people that metabolize the drug quickly would feel more of an effect. But that's something that we haven't done um, for this particular study. Um, but I think that would be an interesting direction.
If you wanted to assay for that, what would that look like?
I think it would just be a matter of doing like a genetic screening to see what sort of polymorphisms people had for CYP2D6. Um, and, depending on whatever variant it is that they have, that would, classify them as being either a poor metabolizer for CYP2D6 metabolizing enzymes or rapid metabolizer or like an average metabolizer. So it would just be a genetic screening, really.
For sure. And then you had mentioned that one of the criteria was for them not to be on any additional substances during the trial period. Was there blood work ran on that, or was it just like, we'll take your to word, or?
Yeah, good question. So we did like a screening beforehand where people had to let us know what sort of drugs they were taking. If they were like on any sort of SSRI or anything like that, then they just weren't eligible to participate in the study. But on days where they came in for the sessions, we did give them a urine drug screening as well to make sure that they weren't on any substances.
Right on. And then is there any long-term follow-up or any sort of follow-up period planned?
No, that would be interesting. We sort of thought about that afterwards as well. It would be interesting to sort of follow up with people, especially for the ones that felt more of an effect. We do, a debriefing with everyone at the end of the session where we just ask them, about their overall experience, and that's typically done maybe about like a week after they complete the study. But there really hasn't been any, or there but yeah, there really hasn't been any sort of follow up since then. But I do think it would be interesting, and maybe, that's something that we can incorporate for future studies.
Cool. Thank you so much. That's all the questions I have for now, but I'll chime in with any others. Who would like to go next? Flash your mics.
Yeah, Mona, if you want to ask your question, go ahead.
Oh, sorry. Hi, everyone. So I have like 2 or 3 questions, somewhat unrelated. I was reading your article and I wanted to know, was there, when the participants came off the LSD, was there like a flushing period where you guys administered anything to make sure that the drug had, metabolized and they were not experiencing any lingering effects? And then my second question is, did you observe any of any of the participants? It wasn't in the study that you said, but like their effect on sleep, if their sleep cycles or dreams were changed with the different dosing of the LSD. Thank you.
Ooh, yeah, the second part of the second question, no, we didn't assess any sort of changes in sleep or anything like that. But that would have been really interesting to ask. The most that we do is we do ask participants to try and sleep the normal average number of hours that they would prior to each session, just to sort of make sure that they don't come in tired, and that may not that might not affect the results. Um, but in terms of asking them how that could have potentially impacted their sleep, and whether there were any sort of differences in sort of dream states, I think that would be interesting to look at, but we didn't look at that. And then to answer to your first question about the length of time between sessions and whether we ensured that there was a proper flush out. No, we wanted, specifically with the study design, we wanted to see the effects of, repeated dosing. Um, and so and so we didn't have this flush out period because we wanted to see whether having the drug still in the system and potentially, lasting these acute effects potentially combining and looking to see whether that would result in any potential like sensitization or tolerance was something that we were included or we were interested in looking at and included in our study design. I hope that answered the question.
Yeah, thank you.
Yeah. Does anyone else have questions? If not, I'll ask some stuff. In the meantime, are you planning maybe on doing like brain imaging or EEG in the future while performing those different cognition tasks and all the different behavior tasks you do?
That's a good question. I know that we are in talks of starting up another LSD study, looking at microdoses and potentially including EEG. Um, and but that's still sort of in the works, and I think that would be an interesting direction to go in. The other thing that I think would be interesting would be, as somebody that asked a question a few minutes ago had mentioned, LSD, interacts with the serotonergic system primarily through the serotonin 2A receptors. At least we know that from a lot of the studies that have been conducted with the full dose of LSD. I think it would be really interesting to see whether those same pharmacodynamic effects apply for low doses of LSD, especially because a lot of the effects that we saw are more stimulant like effects. And we know that LSD can also interact with the dopamine system. So I think it would be interesting to see whether any of these effects that we've been seeing are mediated through the serotonin 2A receptors or through dopamine receptors. Um, so I think for further like future direction, I don't know if we'll end up taking this on or hopefully somebody else will, but looking at whether administering LSD with ketanserin as a serotonin 2A blocker or a dopamine blocker to see whether the effects can be blocked by either or system would be a good direction to go in to see which system may be at play.
That's interesting that you say that. I did with a colleague of mine a study that during development we administered pups with SSRIs, and then in adults they still had like changes in modulation and behavior, like depressed like symptoms, less motivation and things like that. And we saw that it actually was acting through the glutamate system and having a big effect, quite an effect on the dopaminergic cells. So that was quite interesting. So yeah, I think you're probably right there that it has in an indirect way, it modulates the dopaminergic cells too. If the mechanism would be similar there in like low doses. So yeah, that's interesting. Thank you. So
That makes me
are
think
you
of
testing motivation maybe after, or maybe do you repeat like all these different behavioral tests like after a longer time, let's say like after a week of the last dose or a month or so?
Yeah, so we have that. So 3 to 4 days after the last dose, they came in for testing of the same exact behavioral measures to see whether any of the effects were lasting, and we found that none of the effects were lasting. So if um, on certain mood measures that we saw an effect for during acute administration, we didn't see any sort of lasting effects with that.
Yeah, thank you. Rajarshi and Eric, you had the question, and Dr. Olu, go ahead.
Eric, do you want to go first? Thank you. So, could you describe the? It says the drug did not improve mood or affect performance on psychomotor or emotional tasks. Could you please describe which of these tasks were you expecting a change in for microdose of LSD? And do you see this change correspondingly in higher doses or not?
Yeah. So some of the tasks, especially like the emotional processing tasks, you do see an effect at the higher dose. So there's an emotional processing task where subjects would see images of faces that had different facial expressions that would appear for a split second, and they had to correctly identify which emotional expression was being displayed. And it's been shown before that LSD and MDMA have been shown to increase recognition of more like happy facial expressions and happy um, those types of expressions more than you typically would. And so that's seen at the higher dose. And so we were expecting to see something similar at the lower dose, but we didn't really see that. And then in terms of the cognitive tasks, I don't think as if I uh, am remembering correctly, I don't think that has been tested so much with LSD, just because, with at higher doses, because of a lot of the alterations in perception that could happen or that occur at that high dose.
For the emotional response, you might look at mirror neuron based reactions. I think, at least from my very limited personal experience, I think that's a factor. And there might be something around. Okay, and a test that you might look at is long-term cognitive abilities, not short-term. By which I mean, when I say long-term cognitive, sometimes there are people who are very, how do you say, uh, certain tasks which they have difficulty learning because they haven't picked up the
Delaying
necessary
development.
foundational skills. Sorry, go ahead, Eric.
It's a delays in
I might
development.
I'll collect my thoughts and make this comment later. Sorry, go ahead.
No, I'm saying it's a term to to represent that as just delays in development. It's not necessarily that the system can't evolve in that direction. It just has.
Exactly. So it's like the formation of new pathways, the formation of new abilities, and which the person has never picked up before. And these sorts of activities where they've never done something like that, in my experience, but personal experience, I'm not a control study.
Are there any like particular, is there a way of testing that, like any sort of measures for that? Sounds interesting.
I think you could try learning a new language. Just give them 5 or 10 words and ask them to memorize them. And it should be a new language they're not exposed to personally. That might be a way to go.
I would say like really playing a video game. So finding the right cocktail for a person to both experience some of these uh, positive health effects while mitigating some other components such as the lack of focus that could be altered with like corresponding amphetamine for a sustained period of time. So you could balance out the load, see quite the limits or the limitations of human thought and brain activity.
Yeah, no, that's something that we, haven't looked at, and that would be interesting to see.
And one more thing is that there is Heidi, sorry, there is a notable increase in just all around general brain activity. So if you were to look at things that were more demanding, and their performance at something a really demanding task, like something like and this is on microdose. I would recommend this, but not on higher doses. But because in higher doses it could be quite distracting. But if you're suppose taking driving through a really difficult obstacle course while also memorizing words, something that's really tasky and demanding where it requires increased brain activity, I think in a microdose you might find in a control study slightly increased performance. But these are just intuitions.
Oh, and some of the data that I've seen shows that those people perform better on random data, not structured data. So if it's something like an intersection, they have a delay because there's a certain expectation that things are supposed to happen a certain way. But when they're exposed to like random forests or other situations like that, they actually perform better than they were when they were sober. So interesting side effect of that. You kind of see more of the randomness or you chase it.
Yeah, that is interesting. The I guess the closest thing that we did with this particular study was the NBAC task, where it's just a standard measure of working memory, where letters are presented to them one at a time, and they have to respond to a particular letter and back ago, and increase the increase in the number of ends basically back ago are more demanding for them, and we didn't see really any differences on like the two back or the three back or anything like that. um,
Oh, I was referring to the one where they give you a map, kind of like, hey, where's Aldo? And then you get a certain measure of how good people are at randomly searching a map to get the best score. So that in particular is the test I was referring to.
See, yeah, no, it would be interesting to see on those types of measures for sure.
Also, the test with the gorilla to test, I think, for like open-mindedness or so, where you're supposed to observe something, and then just a gorilla walk through, I think, dancing people and people that,
Basketball, dancing and basketball, and a man in a gorilla gorilla suit walks by.
yeah,
Nobody notices. 80% of people or something don't see it.
yeah, don't see the gorilla. It would be interesting to see. I think people probably in a higher dose of LSD afterwards would see probably the gorilla. I'm not sure if they tested it. Please correct me if they did. But it would be interesting to see if there's, because that's what people claim, right?
Um,
To like more minded and more creative and stuff like that.
Yeah, the other thing that has also been reported with LSD are just alterations in visual perception and alteration in potentially visual illusions. So it's been reported that being on a higher dose of LSD can distort or make one unable to see the hollow mask illusion, which is also similar to what's seen in people that have schizophrenia as well. And so I guess it would be interesting to see whether that type of alteration can also happen at lower doses.
You might get a lot of interesting data if you did like an anonymous questionnaire that's academic facing, but about psychedelic experiences and any sort of parameterization or systems of analysis that people have kind of independently developed. At least in some of my experiences, I've found those kinds of interactions in those states of mind to be quite literally like allows you to see the world differently. So definitely collaborating with folks is a must.
Eric,
Hi, IO. Like, what kind of degree do you have in science?
I have a PhD in pharmacology.
No, no, not you, Hannah. Not you,
Oh,
Hannah. I'm sorry. I'm coming. I was talking to I.O. I don't know his name. I mean, like, it's called I.O. Eric. Eric. Eric, what kind of degree do you have in science?
Why is that relevant?
I don't know why you interrupted this conversation to say that, but can I just continue and say, although the dosage that you're looking at is a valid microdose, I just like to mention that the street minimum for it affecting you is generally considered around 50. Although, of course, the effects of microdosing is a very important question. And just along the lines of what I was saying, you might want to look at subjective questions, something like write 100 words, and just see the differences in how they approach that problem, the subjective question or a long form answer. And you might see not so subtle differences in how they choose to approach the problem or how they choose to answer that question. And that just might be another line of inquiry.
Yeah, specifically what I was referring to was the famous interview with the mathematician who kind of described different qualities of his experience on LSD compared to DMT. And I think that just because of the still somewhat controversial nature of it, although the UK is legalized that, so that's something to look forward to. But if anyone's curious, I'm going to pass the link on to
So,
up top.
because you're here, Eric, I thought one should develop a video game for people that are on any type of hallucinogen, and where people put in the amount they took, and then just make them perform, like, make the video game where it tests all these different cognition things that we talked about, to have, I know it's not very clean data, but because people also take other stuff and blah blah, but I think if you have enough data, you can see maybe some. I think it would just be interesting and very cool for people that are on these drugs or do microdosing and stuff like that to do those video games and test themselves, like also for themselves to have like real data, because it's very easy to have like the impression it had some effect on you, but to really design a video game for people that are using these drugs to like perform better, blah blah blah, all these different things they want to achieve, if it's actually happening to them, if it's reasonable to spend their money on it.
Yeah, but integrating it into like a VR headset already puts all the sensors there. It would make monitoring temperature, blood pressure, heart rate, all those things would just be built into the actual structure of the device, making it seamless. So I think that would definitely be something really interesting, especially if you were able to implement eye tracking and somehow interface that with the materials in the world, making them almost pop out as you do in the psychedelic world when you're under that impression that the wall is perhaps melting or things are perhaps behaving in a way they shouldn't.
And just another thing I noticed, the half-life of LSD in the body is 5 days. So maybe, I don't know if it's for a lower dosage, if you can expect it to be completely out of the bloodstream, but maybe having a 6-day gap in between might be more prudent, but I might be wrong here.
yeah, no, it's a good point. I think future studies, um, it would be really beneficial to collect plasma and be able to look at those things as well.
Dr. Olu, you didn't have a chance to speak, so please go ahead.
Sure. Thanks for inviting me up and alerting me to this really interesting paper. Um, and I just sort of glanced at it briefly when I entered the room, and it's really interesting. So I have a couple of questions related to the work. One is it seemed like there were some potent effects for the highest dose for session one, but there seemed to be sort of quick habituation to that. And so, one question is, if you're not microdosing and using standard doses, do you still see that same level of habituation? And could that explain the lack of effects that you saw on mood? So that's number one. Number two is that this was done in healthy adults who presumably don't have a mood disorder. And curious as to what the thoughts are about whether it can be extrapolated to folks with depression. The findings of this study can be extrapolated to folks with depression, because if you look at studies of SSRIs in healthy adults, you might see some acute changes that are possibly related to the mechanism, but it won't necessarily improve the mood of a healthy adult in the same way that it would somebody with major depression. So those are just some of my initial questions and thoughts. Thank you.
Yeah, no, those are really, really great points. I do think that so the population that we looked at here are just healthy individuals, and I do think that we did, initially try to recruit people that scored higher on depression and anxiety scales, but that was a little difficult to do, and so we just decided to go forward with healthy individuals. But I do think that there is a potential for improvements in mood in people that are depressed or anxious or something like that. And so I do think that would definitely be one of the next studies that should be looked at, because it's true that these effects can potentially manifest in individuals that already just sort of show a lower mood state to begin with. And then to your first point about the dosing, um, I don't know if there have been studies that have sort of looked at, repeated high doses of LSD. I think, psychedelics in general are sort of meant to be taken sporadically at higher doses. I don't think that they're, really meant to be taken as frequently as what we did in this study with the microdoses. And I think that's what had piqued people's interest about microdoses, was being able to take psychedelics on more of a consistent basis, like you potentially could with other substances. And so, yeah, I don't know if that's been looked at before in terms of gaining tolerance to repeated doses of higher doses of LSD, but primarily because that's probably not what a typical dosing regimen would be at that high dose, anyways.
Right. I think in some of the studies out of Hopkins, I think it was done once a week for their psilocybin studies. So, but I think it would be interesting to look at some of the same measures you looked at in your study and to see whether you get the same level of subjective experience week after week after week.
Yeah, no, that would be really interesting to see whether any sort of potential tolerance could be gained, from higher doses, um, because then that would, indicate that, the potential therapeutic effects that you could get from them would be limited in terms of only being able to take it every so often and not necessarily frequently, if that is the case, at least.
And I would just say from an implementation standpoint, I think that would actually be attractive, right? If the idea is that you wouldn't have, this is not something that you'd have to take long term in order to get long term benefits. But I think the jury is still out on that.
Yeah, it's true. I know that's sort of what one of the things that um, has been most attractive in terms of with MDMA and its potential. Well, I guess they just did a phase three trial that showed that it is beneficial to help treat PTSD in conjunction with psychotherapy. And, you only need a limited exposure to MDMA. So, I think the same could be said, or the same could potentially go for the therapeutic benefits of higher doses of LSD as well.
Great. Thank you very much.
Yeah, thank you.
And I don't know how to put into scientific terms changing your mind, but it's easier to change your mind when you're even on a microdose of LSD is my hypothesis that I'm putting forward. So I'm not sure exactly how you would test that. Maybe like testing for a personal bias that they have. Like maybe they're scared of dogs and you show them a documentary about how sweet dogs are and they don't hate dogs anymore. So it's things like that. Although I'm struggling to understand how we might test it.
Yeah, I mean, there are some like implicit bias tests that could think that could potentially address that question. It's an interesting point.
Also there's economics, neuroscience studies that people do with, with money, and if people collaborate more with money or less. Uh, yeah, that I agree. That would all be interesting. It's just probably a lot of manpower and money to do all those studies and go through all the data. But yeah, you started a very interesting field, so you have endless things to do. I think you will have a job forever. I think, Hannah.
Yeah, it's very true. We finish up one study and we think that like will help address one question, and then you have a million other questions that start up from that study. And so it's true. We'll be in business for a while.
What So a question that I found very interesting is this tunnel vision effect due to scarcity. So where you make very irrational financial decisions, not just financial but in general. And it would be interesting, or are you planning on going into different subgroups of population, maybe population that has went through different types of stressors, maybe in childhood, maybe in adult life, or both. That I think that it could be different. Maybe the response to the microdosing, because especially during development, stress factors could change the serotonergic pathway.
Yeah, certainly. I think that's a good point. It is quite possible that people that have increased stress in their life, or just that had increased stressors in their life during critical like developmental periods that could lead to lasting or enduring effects. Perhaps LSD can potentially have different impacts on that, just based on its interactions with the serotonergic system. So it is quite possible. I think that would be an interesting other direction to go in.
And maybe you have some insight on this, but when looking at the effect of, for example, marijuana on the brain, it's very subjective and apparently follows very different pathways. No, that's the wrong word. But it has very different effects on different people. So it's highly subjective. I don't know how far that's true for LSD in terms of brain activity and actual physiological effects.
Yeah, I'm not too sure that that's been looked at. I know, cannabinoid use during specific developmental periods has been looked at quite a bit, and I don't know if that's the same for LSD.
Yeah, does anyone have more questions? I also wanted to check with you, Hannah, how much time you still have. um, just to make sure, um, that we don't take too much of your time.
Yeah, no, I'm definitely enjoying this. It's my first time on this app and being able to participate in something like this. So um, so it's been really enjoyable. I will have to put I have a newborn. Well, I guess not technically now. She's 4 months, but I'm planning on putting her to bed sooner than later. But I still have a few more minutes to spare for sure.
Yeah, understand. Not screwing up a sleep schedule is like more important than, I don't know. I think only breathing is more important than that.
Yeah, especially she started daycare this week, and so I've been like trying to make sure I keep on a very consistent schedule. But I digress. So
Yeah, so yeah, if anyone in the audience wants to ask a last question, please go ahead. And yeah, maybe Hannah will join us one day again with like updates about her research. That that would be really great if you would do that, since we we bombarded you with a future. What's the future? So we are obviously very curious about your ongoing projects. So that would be really wonderful. And yeah, please go ahead if you have another last question, and then we'll let Hannah rest and let her go to her baby.
I was curious. I didn't hear if you guys talked about this. I was kind of doing other things, but did you guys talk about the creativity link to it? Uh, and just how that works, and if you've seen a lot of increase in creativity and stuff like that.
Hmm. Yeah, no, that's a really good question, especially because a lot of the anecdotal reports of people have been saying that microdosing has really helped, sort of boost creativity. And we did not incorporate any creativity measures for this particular study, but in the LSD study that we're thinking about starting up pretty soon, there is a creativity task that we are planning on throwing in there that will be able to potentially tap into any changes in certain aspects of creativity. So yeah, no, that would be really important to look into.
I'm sorry, just a quick comment here is that LSD is seen as a toxin by the brain. So part of the reaction and response is sort of fight or flight kind of thing, where it's like the brain has to defend itself against this toxin. So a test where you're looking at if a person is fighting for survival rather than just comfortable, how he might respond differently, or in a more agitated or more involved sense. Although at this moment I'm not able to think of how you might affect that.
Yeah.
Katie, what's up?
Yeah. So that would be I think yet another interesting direction. I think that it could go in as well. So many different. I feel like I'm getting a lot of ideas from chatting with you guys tonight, which has been great.
Yeah, what would be the test? I mean, in mice we can do the swim test, to see how long they keep swimming until they give up. But I'm not sure if we should do that to people. But yeah, I don't know what the test would be.
Yeah, and ideally, I would say go towards subjective tests, even though they're harder to sort of derive metrics for. Because I mean, like the creativity angle and a few other things, which anecdotal evidence supports that, certain activities, subjective tests might be better, although harder to derive objective results from them.
Hi, Zaidi. Israel, how are you doing? You want to ask your question? Or Brandon, did you want to follow up?
No, I was just gonna say, hey Zadie, good to see you here, man.
What's
Did
up, guys?
you guys want to do like a maybe a short reset of since you just came in of what we're talking about, some of the things?
Yeah, should I? So we were talking about a study that Hannah, Dr. Molla did, where she gave adults, healthy adults, different microdoses of LSD, and actually, surprisingly, there was not too much of a difference in cognition. There was a little bit of a difference in some emotional cue recognition, and the when there was a difference, it was more significant, I think, in the first dose, but then not later on in the next doses. So yeah, it's kind of a little bit. I'm interpreting it.
You're
Kind of
saying we got to
debunked.
keep taking bigger doses.
Well, that's what I'm saying all along, but Hannah did actually the work to test this, so I didn't. But yeah, so taking once, that's my, what I take from it. And from compared to the studies with high doses, where people that have quite a impactful experience, they really see a really beneficial effect of taking hallucinogens, versus, this microdosing study, the first one, which Hannah here did, um, didn't show this related, or in mood, for example, improvement in moods, um, and things that people report. The study didn't really show that. But Hannah, please correct me if I overstated something.
No, I think you summed that up. That you summed it up perfectly. The most of the effects that we saw were more prominent. The minimal effects that we saw seemed to be more prominent on that first exposure to the dose, and then subsequently it seemed to decline more. And I guess the other thing would just be that it was primarily on the dose at which people felt more of a subjective type of effect. So at the higher microdose, the people that had received the lower microdose didn't feel very much of an effect, and their overall, most of the measures seemed to look very similar to placebos.
Is it unethical for the scientists perhaps running such a study to be a participant? Are there any exceptions or loopholes like that? 'Cause I feel like for the study of the human mind, you would want people on the ground floor or the grassroots or wherever this is happening. You would want them there at the front lines of understanding of consciousness of reflection. So, if appropriate, would you be willing to comment on that?
I mean, it's a really good point. I don't know if I really have like a good answer, a clear-cut answer for it, but I mean, it makes sense that, um, you know, that to sort of get to be able to get inside of the mind, and think about, what potential improvements one can be on while on a substance, or what sort of alterations you're experiencing in terms of perception. I mean, that could very well help you with designing a study to sort of tap into those things. So, I mean, it's a good point, and I think it's something that is discussed quite a bit among people that research psychedelics and other substances as well. But I don't know if I don't know. Yeah, I don't feel like I have a clear cut answer on that. So yeah.
Oh, okay. I guess I was asking, like, if you've participated in these kind of cutting edge experiments from the perspective of, I think historically, I had a friend who kind of went overboard with a similar drug, DMT, and ended up convincing himself of some crazy narrative that there were these creatures talking to him about these equations, and he approached his professor and said, "You're all wrong. These are the equations that work," and so on. At least that's story that he told, but it was through this kind of almost toxic spiral that some people can get into, and they quite literally lose grip with reality. And one of the things that was interesting for me to note when working in the neuroscience lab here was that we had to pass an ethics training course that mentioned MK Ultra and the LSD experiments in Canada, where the CIA kind of had people were conducting experiments on them, like locking them in a dark room for 60 days and dosing them with LSD all the time. One woman went so far as to forget her own children. She does not recognize her own children. She had something like 3 or 5 children, if I'm not mistaken, but I don't recall exactly. So, disclaimer: it can be dangerous, and each of us have our own vulnerabilities. So, I guess just to make sure that anyone in the audience is like, oh yeah, this is like a great idea. There's a term like scripting and all these other things, but please just be careful.
Yeah, good point.
So are we going on a magical journey in the forest together, or what's going on?
Yeah, that's exactly what we're talking about. And, the kind of parameters that define healthy adults and low doses of LSD with Hannah Molla here. So, link is above.
Yeah, there's a lot of interesting studies. I remember reading one in regards to PTSD, where they were testing on veterans, and they were giving them also microdoses. And when it came to rates of suicide, rates of depression, and all that kind of stuff, they found it to be very, very effective. Would you agree with that, Dr. Mala? I'm curious because seeing as you are a doctor who does research in the space, or do you think that's more so a placebo effect? I'm just curious.
Yeah, no, I think the study that you just mentioned with MDMA, that was a phase 3 trial that was conducted, which is, pretty large, and they did find some pretty strong evidence in support of MDMA in conjunction with therapy having really beneficial effects on PTSD. And so yeah, no, I mean, I think what you're saying is true.
Yeah, it's very interesting. And then other psychedelics like mushrooms, a lot of studies opening up now that they wouldn't normally practice. You know, very broad scale studies, and it seems very, very interesting.
It would be interesting to perhaps host a room and have come up and kind of describe how they themselves and amongst their friends have spoken about this kind of experiences to kind of get a preliminary feeling of distribution as well. Like, so some self-selected bias, these kind of studies where you're not going to necessarily be representing the whole population because the whole population is crazy. So you you want controlled experiments. So
The Valse of Arrowwood session.
yes, that's a great example. Like Erowid sometimes sounds ridiculous, sometimes it sounds like it's a brilliant person, and because of the anonymous format, it loses certain credibility, I think, and it's an unfortunate missed opportunity because I think, like for example, with MDMA, one of the descriptions that was shared with me about the benefit of it was that it allows you to recall the traumatic memory, but not be at the jeopardy of your physiological responses to fear or flight or fight. So you have this almost like detachment, and through that process of new interpretation of that memory, you no longer have as strong of a physiological experience next time, because every time you access the memory, you necessarily rewrite it. So quite literally, thinking back on your life, you can edit some points of a story so much so that people who were at 9/11 at the two towers, they were standing at one corner of the intersection. A decade later, when they were asked, they reported the other intersection, and they were absolutely certain of it, and then they showed them the footage. So there's also that unreliability of human memory or humans to tell good and accurate stories. So
Random overwrites. Yeah, interesting.
It's kind of hard to hear. I don't know if he was breaking up for everybody, but were you referring to? Of course, I don't have background in any of this, but my knowledge, like the our natural uh, uh, the way our brain works is that it the fight or flight. I think it is it from the amygdala. Like it'll shoot blood to your feet or something like that, so you can run faster in a flight situation, or shoot or there's a that initial freeze allows you to think that if it's better to run or hide. Is that what you're referring to?
Yes, there's like the priming of your neural pathways is something that you can train your body, and so just by it not being an automatic process when you're on MDMA, being kind of opt in, you're like, would you like to opt into this emotional crisis moment? Click yes, no, or ask me later. That's kind of how I would describe it.
Right. So, say for example, if it's a fighter in a boxing ring, like if they're that whole scare tactic, they're using that to get blood to rush to your feet so that your hands are slower, right? If you were able to control that better, I guess that's why they use like those what do they call them? Beta blockers or something like that, so that you can kind of control it. Is that the same?
Eric, is there a way to maybe make some slight adjustments because your audio is literally like cutting in and out, like almost like a radio, you know? And it could be kind of hurtful for people who are
Yeah,
maybe audio sensitive.
my
So,
apologies.
yeah, just letting you know. Yeah, yeah, of course. Just, maybe it's an internet thing or
Yeah, yeah.
maybe
This
your
Canada
microphone.
internet sucks today. Sorry. Hashtag Putin. Thanks, Putin.
It was
But you were
perfect
coming
when
in
you
so
said
great
that.
right now.
It was perfect for that line.
See, there you go again. Putin got me again. God damn it, Putin.
He
Audio
said
is actually
Putin.
better now. Now that you're talking, it's better now.
Yeah,
Now that
yeah,
you
yeah.
say
Not
peace
using my
Putin,
headset.
Right. Putin heard his name and he said, "Oh,
He
we
did.
can
He
let that
totally
go too."
fixed it.
I think Elon intervened.
Oh, okay. I was
With
wondering.
the broomsticks. The broomsticks.
Yeah, exactly.
Elon's got his handful from with Russia right now.
How so? How so?
Well, he started pushing back on them.
In Soviet Russia,
Oh,
you
Russia.
don't push, the wall pushes back. So I don't know how that's going to work out for them.
Yeah. Well, Hannah, I wanted to check in with you. We can have a conversation forever, but I know you probably don't. So I wanted to check in with you. Please let us know if you need to go. Yeah, we can always have another room someday. So yeah, let me know.
Sounds good. Yeah, my baby's back here starting to get a little fussy, so I think I might log off. But it's been really great talking with you all and being able to discuss our work with you, and also just hearing about the different ideas that you guys have suggested as well. So yeah, I mean, I'd be more than happy to come back and talk and maybe join in on some of the other sessions that you guys have coming up as well. So, yeah.
Maybe
So,
we can convince Lee Cronin to do some psychedelics live on Clubhouse with a bunch of other
Yes.
brave academics.
Yes.
So
Very,
I
very interesting. Love having you,
yeah,
Hannah. Very interesting topic.
yeah, I totally agree. I asked the guy that did the recent toad study to come here to present. He wanted seriously $2,500 to
What?
give a talk. I said, I'm sorry, we all do in our free time. Nobody makes money here.
wow.
That is crazy.
I thought it would have been an interesting discussion, to have like several people doing these studies, but yeah,
That's
so,
kind of a sad indicator of the economy, though. If because normally I maybe sometimes some foreign academics have like a side gig or a side hustle, and you're like, this is not even related to anything that you do. And that's kind of what the rest of the world does, whereas I find that not to be so common, at least in North America.
Wow. Yeah. And their work is really interesting too. So yeah, I mean, it'd be really great to hear, straight from them. So yeah.
Yeah, I answered, yeah, I'm sorry, we don't have any funds. We all do this for free, but if you're not interested, then I understand. So he didn't answer back. So I guess that's a no. I could try to like
No, we could sweeten the deal. I'll give it a shot. Just forward me the email, and I'll see what I can do.
okay.
Wow.
Let's thank you, Eric. Okay,
No
we'll do
pressure,
that.
no pressure, right? No pressure.
Wow.
Got some ideas.
Wow.
Hannah, we would be thrilled if you would join us again in the future on stage and wherever you're comfortable. That would be great.
Yeah.
Yeah.
Thank you so much for
Yeah,
being
thank
here.
you, Anna.
Of
We
course. Yeah.
really appreciate it.
Thank
And
you.
Thank you for doing such awesome research too, though, because
yeah,
I think it's like 10 years ago, this kind of stuff, nobody talked about this. And this is now at the forefront of human consciousness. And so it was a real pleasure and a treat to have you here. And I hope you join us sometime in the future.
Yes.
Yeah. Sounds great. All right.
Thanks,
Well,
Hannah.
thank
thank
you.
you.
Have a good
Thank you,
night.
Anna. Have a good night.
Thank
Bye.
you. Bye.
Bye.
Night.
So just some quick announcements. Follow the club, of course, as usual. And tomorrow at 1 p.m. EST, we have a microbiome researcher, Dr. Needham. She will talk about her study where anxiety was linked to gut microbiome metabolites. So that will be really interesting tomorrow at 1 p.m. EST. And we'll have a lot of more exciting rooms coming up from different research areas. So next week we'll have another autism researcher. Actually, her team, like two of the researcher team, will be here. They actually have a company, so they will present on Monday at 10 a.m. EST. They're um, from Israel, so they are on that schedule. So they will present. It's a really interesting study about autism identified during first year of life, and the interventions that they came up with look really, really promising. So if you are interested in autism related new treatment options, that's the room for you. And then we have on Tuesday, and I'm really excited about that. I don't know if you heard also on NPR, the study was discussed about musicality and age interaction and tone development. It's the study where they checked people and kids coming from different first languages. So if they grew up in a language that has a tone, like for example Chinese, versus growing up in a language that doesn't have a tonality, such as English or most European languages, there's a huge difference in and the perfect pitch, so tonality, and that's very interesting. And they ask themselves the question, how come? So it points that during development, exposure makes a huge difference. So I'm really excited about that because I heard about it in the radio and she said yes. So I'm excited about it. There will be more interesting rooms that I don't want to count all here because, you will forget it. I would forget it anyway. So yeah, keep coming back and thanks for coming. Thanks for a great evening, everyone.
Thank you.
Thank you,
Thank you,
Katerina.
everybody.
Good night, everyone.
Okay.
Take care.
Bye. 3, 2, 1. Bye.
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 Bye.